My name is Christa Cobbaert. I'm the chair of the IFCC Scientific Division, which is majorly involved with metrology and standardization and trying to contribute to safe and effective, well-standardized medical testing. I think it's very crucial in order to in a molecular way, we should characterize disease. And that demands, of course, that you should know the measurand that you intend to measure. And if you can do that, then it allows you to standardize also the test, which makes it much more sustainable in time and space across medical labs. And the development, of course, of reference measurement procedures on top of routinely well-standardized method is the way to go, because then you really secure the future with sustainability and exchangeable medical test values. I think lab professionals should be much more aware about what they are measuring. This is now currently often not the case. It's not mentioned in the instructions for use. And mostly we measure, for instance, in case of small molecules, both the compound of interest, but also the metabolites. So it's a mixture. For proteins, it's the same. They have a lot of proteoforms, and we also measure a total amount of proteins derived from one gene and give the doctor a result, whereas a lot of hidden information can be beyond it. And it can be relevant to know that. It can harm patients if you are unaware. So our disciplines should look and dare to raise the bar and say we have to know the measurands, and we need for some indications better technology in order to be able to measure them molecularly. And maybe I should add also for the viewpoint from the industry, because there are two aspects. End users on one hand, but the IVD industry should also then in fact embrace and adopt the candidate reference materials that we develop, or the certified reference materials, and the reference measurement procedures, which are IFCC endorsed and listed in the GCTLM database that stands for Joint Committee on Traceability in Laboratory Medicine. So both parties, both stakeholders have to work together to improve that situation. That will, of course, majorly affect the downstream consequences for patients. We are obliged to have safe and clinically effective tests. If you know what you measure, you can much safer contribute and prevent that clinicians get confused because of inaccurate or confounded results. In this case, with standardized mass spec, you will deliver them very accurate results so that you can contribute to better patient management and in the end also better patient outcome. We have to bring in clinical mass spec into medical core labs, and it's very essential that this is done in a practical way. So it should fit in the total lab automation concept that most medical labs currently have, so that the logistics, the way of processing, the way of reporting is similar to what we currently have, to immunochemistry, chemistry, and hematology analyzers. If that can be done in combination with having minimal maintenance, very good service, just like we have on the regular analyzers, that is crucial to adopt it in medical labs, in combination with a broad test menu, because also the cost effectiveness of introducing a more expensive technology can only be done if there is return on investment and if it fits into the processing of hospital labs as is currently.